Good evening. I'm Ben Singer.
And I'm Tina Tyus-Shaw. Surge. That's what we thought we were avoiding back in April and May. It was working. Then we stopped.
Now, this won't be a finger-pointing political debate here tonight. No, tonight we will be establishing exactly where we are with COVID-19 and talking about what must be done locally to avoid becoming Florida, Texas, or Arizona.
So where are we? In our coastal health district, COVID cases were at 850 at the end of May. Today, 6,000 and adding at least 250 every day.
In Chatham County, at least 155 new hospitalizations in the last month, more than the previous 3.5 months combined. Statewide, they've nearly tripled in a month.
In Beaufort County, there were a total of only 23 new cases in the 2 weeks after the stay-at-home order was lifted. In July, 2 weeks means nearly 900 cases. In Georgia and South Carolina, more than 4,000 people have died. That's where we are. The Board of Education for Savannah Chatham Public Schools voted unanimously today to begin the school year online and push back the start date to August 19th for the district's 37,000 students. That was the recommendation made by Superintendent Dr. Ann Levette. And Dr. Levette joins us now live to discuss these decisions. And thank you for being with us tonight.
Thank you for having me.
Well, Dr. Levette, while the board approved the plan, several members were disappointed that there was not another option, perhaps some instruction in school and some online. Why is there only one option right now? And will the virtual option still be available if you're able to return to the classroom for those parents who want their kids to remain at home?
Yes, so thank you for giving me the opportunity to provide clarification on that. We will start the school year virtually, and as soon as the conditions allow, we would like to return to face-to-face instruction. Now, what that will look like, I'm not sure, but that's our goal. So, we want to do that, but there will be parents who wish to continue online instruction, and we understand that, and we have a dedicated school now, as you know, the e-learning academy, which allows us to have students permanently enrolled, at least for the year or the semester, using that model. So for many of our students, yes, they will want to return to face-to-face instruction, and we want to get there. But for many, they will want to use the e-learning academy or a virtual learning experience through their regular school, and that will be an option.
Well, Dr. Levette, I'm also wondering what will be the protocol if someone in the classroom gets infected?
Well, we do have a prescribed protocol that has been laid out by the Department of Public Health, and certainly there is contact tracing involved. There's also an opportunity for us to move those students and or staff to other locations. Based on what we learn, we may decide or we may find it necessary, according to the guidance issued earlier this week, to either close a classroom or to close one building or to close more than that. So it all depends on the individual case, but our intention always is to follow the guidance provided by the Department of Public Health, and that will be widely publicized as well. But we must caution people to understand that each case is different.
I understand. So real quickly now, when do you hope to make a decision about the return to the classroom?
Now that depends totally, not totally, but it depends in large part on the rate of transmission in our community. I firmly believe that we will work as a community to reduce the number of positive COVID cases. And if we can do that and we find it safe, then we may open in a version of face-to-face, allowing parents to choose, if the case numbers are lower, to return their children to school or perhaps to remain on a virtual format. But we do hope that that will come, hopefully later this year.
Okay, Dr. Levette.
I don't think it's going to be immediately.
Thank you. I'm sorry I have to interrupt you and wrap for now, but we certainly appreciate your time, and we do wish you the very best to all of Savannah's Chatham County school students in the coming school year. Thank you.
And let's take a look now at the back-to-school plans for other districts in the Coastal Empire. Candler County will start classroom instruction only on August 3rd. Coffee County starts August 7th. Effingham County students return on August 5th. Evans County returns on August 10th. And Glynn County goes back on August 11th. Coffee, Effingham, Evans, and Glynn are all offering classroom and virtual learning options. Now, Jeff Davis County pushed back its start to August 20th and will offer traditional and online options. Liberty County starts August 4th. In-person and virtual learning will be available. Long County goes back August 10th, and Screven County returns August 17th. Those districts will also offer classroom and online instruction. Tattnall and Toombs counties are offering classroom instruction only at this time.
In the Lowcountry, 3 local school districts are all working on their own plans to start school. WSAV News 3's Andrew Davis is joining us live with what he's learned.
Well, tomorrow will be a big day for parents, teachers, and students in Beaufort County. That's when the school superintendent's going to announce the plans for the fall semester. While Governor Henry McMaster says classrooms need to open, some local school administrators don't agree with him.
Schools must have in-class, face-to-face teaching so these children do not fall behind. Ladies and gentlemen, if they fall behind, just in this one period, they may never catch up.
We certainly welcome his thoughts, and we will take those into consideration now that we haven't already. But our plan in Jasper County School District, we stand certainly behind.
It's a plan which starts a semester on August 17th in a total virtual format.
We are providing, again, as Governor McMaster has asked, choice to our parents. Our choice, though, will be contingent upon what is safe.
And with Jasper County now in the high category for COVID-19 cases, safety begins with classes at home.
I'm not in the business of playing Russian roulette with anyone's life, and that's really what it feels.
To make sure they get a good education, Jasper County will provide devices for all to learn on and mobile hotspots for internet if a family needs it. While the semester will start online only, the district will monitor the changes and potentially bring students back to class.
It's a sound plan. Our calendar is set.
I'm concerned about all of them. We're looking at how we address those critical things, you know, like their social emotional well-being, for example.
In Beaufort County, that's just part of the consideration when it comes to in-person or virtual instruction. Superintendent Dr. Frank Rodriguez admits with 2,100 cases and 24 deaths in Beaufort County so far, it is a difficult decision. He writes, "I cannot in good conscience commit to a reopening plan that would knowingly put them in harm's way. If COVID-19 conditions continue to worsen, we may need to rethink our reopening strategy. It's entirely possible that we could start the year with all students learning virtually." Now, Beaufort County will announce its decision tomorrow, but it won't start any classes until September 8th, which is just as the governor recommended. That's the same day that Hampton County schools will begin. That district isn't presenting its proposal to the school board until July 27th. They're currently working on 3 different learning options, which are hybrid, in-class, and online. Andrew Davis, WSAV News 3, on your side.
Andrew, thank you. WSAV is on your side, recognizing the heroes who are helping others during the pandemic. Dr. Lucille Bacon is the go-to person at Thankful Baptist Church. She prepares bags of food and delivers them to families in need. Dr. Bacon also sends cards and keeps up with the elderly church members.
Stay with us, everyone. Our COVID-19 special coverage continues after the break. Governor Brian Kemp says local leaders cannot order anyone to wear a mask, but Mayor Van Johnson is standing firm in his mandate for Savannah. He is willing to take the fight to court, and Mayor Johnson is joining us live now to talk more about it. Thank you for joining us this evening.
Thank you, Tina. Thank you so much for this opportunity.
Well, talk to us, if you will, please, about your response to the governor's new executive order. Since there are mixed messages about masks, what do you want the people of Savannah to do?
Well, I want the people in Savannah city limits to know that we still have a mandatory mask order. Nothing has changed. Unfortunately, throughout the state and our national government, we've been throwing mixed messages all over the place. Our reality is this. We know that wearing masks, social distancing, and washing of hands slows down this virus. Let's be very clear. In May, we had 266 confirmed cases. In June, we had 809 cases. And in July, we're over 1,000 cases. let's be very clear. At this point, where we are, we've had more cases in July than we've had in March, April, May, and June together. And so this is real. If Savannah's going to get beyond COVID-19, we have to do the right thing now. I know it's inconvenient. I know it's rough and difficult and uncomfortable, but we have to follow the science. We're not going to get involved in politics.
Mayor Johnson, I'm wondering if you could have a conversation with the governor, what would you tell him?
I'll say, come on, man. I mean, you're saying yourself, you know full well, and you've said it, you've gone around the state saying that we should wear masks. You know what the science is. I mean, if you want to give an order statewide, as they've done in Alabama, as they've done in Texas, as they've done in other states around the country, I mean, hey, we'll back off. This is not about politics. This is about public health. This is about public safety. And until you've seen someone in the COVID bed, until you've seen healthcare heroes busting their behinds, trying to help keep people safe, I mean, we have to be able to deal with that. We do not need Savannah to shut down again. It would literally kill our community.
We have just about 30 seconds, so I want to get this question in with you. What is your response to the petition to recall you as mayor? And one of the reasons cited is because of the mask order.
I would say that if I am being accused of making sure the Savannahans and their businesses are safe, if I am accused of doing everything I can to make sure that we get past COVID-19, I am guilty as charged.
Mayor Van Johnson, we appreciate your time tonight and look forward to talking to you very soon. Thank you, sir.
Thank you for wearing your mask, Tina. I appreciate that.
Thank you.
Families continue to feel the financial impact of the pandemic. Lawmakers are working to pass another relief package. WSAV.com Now reporter John Dowding spoke with Kelly Meyer in our Washington newsroom to find out about what's included and when people might expect a payment.
Kelly, a lot of people are wondering about some more relief that is going to potentially come from the federal government after that first round of stimulus checks. So can you help us figure out when can we expect to see some more guidance, some more help, some more resources to be able to combat the pandemic that's still going on? And when are leaders expected to vote on it?
Yeah, John, that is the big question right now. How are they going to come together to help people get through this ongoing pandemic? Like you said, House Democrats are saying they've already passed a plan, the HEROES Act, 2 months ago. But Republicans in the Senate have dismissed its $3 trillion price tag. They're now working with the White House on their own plan. It's expected to be $1.3 trillion and expected to include financial incentives for schools to reopen and shield healthcare workers and companies from lawsuits. Republicans could introduce that proposal as soon as next week, because right now they are not on Capitol Hill. They would have to return here to DC, work on this before the end of July, before their next recess, where they go home for the month-long August recess, going back to their districts. House Speaker Nancy Pelosi already said if they can't get something done, she's willing to postpone or even cancel that recess to get something done. Democrats say the next stimulus package should include at least $1 trillion for state and local governments and another $1 trillion for extending unemployment insurance provisions and another round of direct payments.
We'll continue our COVID-19 special after the break, but first, meet Jeff Clare, the CEO of Be a Hero, Hire a Hero in Statesboro. Thanks to Jeff, more than 11,000 veterans have returned to the workforce. He's also active in his community as the founder of Bullitt County's Anti-Bullying Day. That is why Dr. Amy Kitching nominated him for our heroes. Welcome back, everyone. Time now to meet another one of our heroes. Lorraine and Terry Heaton are helping homeless veterans stay safe in Savannah. They make masks for them and deliver about 60 every week. The Heatons have also made about 650 masks for friends and family in the Lowcountry.
Throughout the pandemic, healthcare workers have been hailed as frontline heroes. Their tireless efforts have saved many lives.
A doctor working in a COVID-19 wing at St. Joseph's Hospital shares her experience with WSAV News 3's Alex Bozargian and what she hopes the public will do to stay safe.
I think every day there's an element of fear. Despite the social distancing measures that have taken place, we still see a lot of people getting sick, and not just sick, but very sick. So our nation, the world hasn't seen anything the likes of this since 1918. But in terms of, since I've been a doctor, no, this is all new, and this is, I think that's what makes it so worrisome, and what makes people scared is that this is unprecedented in our times, in our lifetime.
Dr. Asma Khan puts her own fear aside for her patients. She doesn't have all the answers, but every day she gives it her best.
Anything that we do as physicians, we always feel pressure to do right by the patient, to make sure they're getting better, to make sure their families are updated. I think there's an added dynamic here that we don't have families at the bedside in the hospital with their loved ones, and often that's a missing piece of the history, and there's pressure from that standpoint.
Khan says the pressure keeps her fresh. Like other doctors, she's always looking to new research and new ways to treat her patients.
We don't know how this is going to play out. We don't know when it's going to end. All we can do is look to the advice of the experts and follow their guidance. I take it day by day. I can't think, a year down the line, is this still going to be my life? I take it day by day because that helps me bring the energy forward, the mental energy I need to help my patients the most.
Every day on the hospital floor, Khan faces the consequences of COVID-19. She's looking at the same data we are. Cases are going up and more patients are being admitted.
I don't know what I can say that will make people listen. People have to take that responsibility on themselves. I can't force them to do what they don't want to do. All we can do is provide our advice and say that wearing masks and social distancing is important. It is a free intervention that can make a difference, and it's a minor inconvenience. So if you can do it, you should, because although it might be slightly uncomfortable or slightly inconvenient for you, you could be saving somebody's life. So I would just encourage people to do the right thing.
Khan says she's proud to wear this white coat, but it doesn't make her invincible.
There's times where you're worried about your family, I'm worried about my team, they're all exposed. What if some of them get sick? What if they take it to their family and friends? We have our moments. We're human. Regardless of what happens out in the community, regardless of the personal decisions people make, I'm here to help you if you get sick.
Reporting in Savannah, Alex Bozargian, WSAV News 3 on your side.
Charlene Brady is a hero in her community. She is the director of the You Are Not Alone support group in Statesboro. She gives diapers to mothers in need and provides backpacks filled with food for children so they don't go hungry. Brady and her husband, Kevin, also prepare grocery bags for families in need.
This hero has a name that fits. Comfort works as a cashier at Publix on Wilmington Island. She always has a smile on her face, cheerfully greeting customers, and she always has a pleasant attitude, something we can all use right now.
COVID-19 has changed our lives, but more importantly, it has taken lives.
WSAV News 3's Joanne Merrigan has more now on those who fought the disease and what it means for families of those who lost the battle.
In times of crisis, we can look for moments of joy. And when someone survives COVID-19, that's a good day at any hospital.
I just can't believe I'm going home after 47 days. Oh my gosh. Oh, you just don't know.
Laverne Williams left Buford Memorial Hospital after being there for 47 days, 28 of them on a ventilator.
If it wasn't for them, I wouldn't have made it this far because they inspired me. They had that good energy.
Imagine this might be you or a friend or your mother fighting to survive.
Her test came back positive, and my biggest fear at that point was, what do we do now?
Kimberly Webb faced the unthinkable. She lives in Savannah, but her mother was in a nursing home in Virginia. Her last vision of her dying mother was on Zoom.
The most disturbing part was not being able to be there to hold her hand. I had to have the nurse hold her hand for me.
This virus has taken a lot from a lot of families. David Jackson was diagnosed back in February, hospitalized for 30 days and on a ventilator for 11 days. When discharged, he could barely stand and began physical therapy. Another example that problems from the virus can linger even if you survive it. But he did survive and wants to help others if he can.
I want to provide to them my serum. Maybe there's a key in there.
If you say no one in your family has had the virus, one thing we may have learned in this crisis is that everyone may be becoming family, from the hospital staff that works night and day to save lives, to those who endure loss.
I just miss my mom.
And to those who know what this means and want us never to understand it.
I'm begging everybody, please take this virus serious, because it's for real and I lived it.
Joanne Merrigan, WSAV News 3, on your side.
We want to thank you for joining us tonight. WSAV is on your side and will continue bringing you the latest COVID-19 news.
For testing information, updated case numbers, and much more, visit WSAV.com/coronavirus. Good night, everyone.